I'm here to tell you that every 35 years old woman can still give birth normally, have a healthy pregnancy, have a healthy delivery, have a healthy labor, have a healthy children, and you can achieve the number of children you want to have even from the age of 35 to 40. It is very, very possible, and you can achieve them naturally without IVF. Advanced maternal age, put you at risk of having a child with low birth weight. You are also at risk of having a cesarean birth. Yes, because of the advanced maternal age, you may be at risk of having a cesarean birth. Hello, welcome to my channel. My name is Nurse Valerie. I'm a registered nurse midwife and a certified family planning care provider. So in this channel, I talk about pregnancy, I talk about labor, I talk about delivery, I talk about maternal and child health tips, and I talk about family planning and reproductive health. So today I want to talk about advanced maternal age. That's being pregnant after the age of 35. The risk factors associated with it, the things that we all need to know, as a woman. What are the factors that made women to be giving birth after the age of 35 or 30 and above? Okay, if you observe recently, during this era, women are getting married mostly after the age of 30 or in their late 20s, compared to the olden days where immediately you clock 18, 16, even teenage pregnancy were rampant, teenage marriage were rampant. So now you discover that women want to go after their career. Girl child education, especially in Africa, has made women to, progress in their career before getting married and thinking of having children or settling down. Even social media and the way the world is revolving has made people to decide sometimes not to have children. Some people have decided that after getting married, they don't want to have children, and that is very much okay based on your decision. So now, what are the risk factors associated with having a child after the age of 35? So in this today's topic, I want to dive on the risk factors associated with having a child after the age of 35. Number one is you are at risk of having gestational diabetes, because of the advanced age. Some medical condition may have set in, and sometimes women develop, some complications after the age of 35 years. You are also at risk of having developing gestational hypertension. Yes, gestational hypertension is also you're also at risk of developing gestational hypertension after the age of 35. You're also at risk of having a child with birth defects or chromosomal abnormalities. Yes, after the age of 35. You are also at risk. So you are also at risk of having miscarriage. Yes, you are also at risk of having miscarriages. Although miscarriages are common among women, especially first time pregnancy, some women, during their first time pregnancy, experience miscarriage. So you are also at risk of having low birth weight. Yes, low birth weight, advanced maternal age, put you at risk of having a child with low birth weight. You are also at risk of having a cesarean birth. Yes, because of the advanced maternal age, you may be at risk of having a cesarean birth. That doesn't mean that people older than 35 years doesn't give birth naturally. Of course they do, but these are just risk. All these that are mentioned are risk that you may be exposed to having a child after the age of 35. Now, what are the benefits of having a child after the age of 35? Because everything that has advantage has disadvantage. So what are the benefits? Number one, you are financially stable and balanced to take care of your pregnancy, to take care of your labor, to take care of your delivery. You are well educated, you are well informed than a teenager or a woman who didn't go to school and know nothing about education, know nothing about pregnancy. Secondly, you have the chance of living longer. Yes, having children after the age of 35 years, yes, can increase your chances of living longer because a teenager or somebody who is not well educated can have as many children as possible, may not even know the implication, may not know the contraceptive to take in order to give an adequate spacing in between her pregnancy. But you, at the age of 35 or after the age of 35, you are educated, you are well informed, and you can take care of yourself. You can Google and know the conditions. Just like now, you are watching me on YouTube. You know, I'm informing you. You have the resources to buy a phone to access the internet. And most women in the rural areas, younger, and giving birth at a very young age, may not have resources to have access to this information that we share on the internet. Then you have the resources to train your child. Your child, the children that you give birth to, have a better education. They have a better quality of life because you are well in your financially and economically stable to take care of that child. So here are some of the benefits of having a child after the age of 35. So here are the questions. Is it still advisable for a woman to have a child after the age of 35 years? The answer is yes. Most women has given birth after the age of 35 and their children are healthy. Some of us are the product of pregnancies after the age of 35, and here we are okay, bouncing, intellectual and everything. We are okay. So you shouldn't put your life at age because you are running late, or you are not married, or you've not given birth at the age of 35, and probably you may be tagged a geriatric mother. That word can be so, geriatric pregnancy. The geriatric pregnancy means pregnancy after the age of 35, advanced maternal age. So many people, they ask you, what does that mean? Am I that old? No. It's just a word to describe an advanced pregnancy, a pregnancy in advanced maternal age. So now, the only thing that if you're above 35 years and you're thinking of getting pregnant, you just have to ensure that you go for your antenatal care. Ensure that you go for your antenatal care. Visit your doctor or your midwife. Don't always miss your scheduled visits. Secondly, you must quit every lifestyle factor that may affect you or your baby, such as smoking, alcohol drinking, or eating, junks, anything that will affect your pregnancy or that of your child. You have to stop it immediately. So now, other lifestyle factors that may expose you to certain, maybe stress, being under too much stress, you have to ensure that you're not under stress. If your work exposes you to a lot of stress, then maybe during the period you are pregnant, you just have to, if you're going to take an excuse, if you're going to tell your doctor, if you're going to get a medical report so that you'll be posted to a place that has a work that is less stressful, then it's also be good for you, because being pregnant after the age of 35 can pose a lot of risk, and you don't want to have that. Many women have a successful pregnancy, but it's good that you avoid anything that will expose you to that risk ahead, so that you don't see yourself developing some medical condition that may complicate your pregnancy. So other things is ensure that you don't abuse drugs or take drugs without your midwife or your doctor not knowing the type of drugs you are taking. So now, having children after the age of 35 is still okay. Your fertility is still okay. You can give birth normally. You can have all your children. Even at the age of 40, 42, women still give birth naturally and they have their children normally at that age. So you shouldn't put yourself at the age, or don't pressurize yourself because you want to have a child or you want to raise children before the age of 35. I'm here to tell you that every 35 years old woman can still give birth normally, have a healthy pregnancy, have a healthy delivery, have a healthy labor, have a healthy children, and you can achieve the number of children you want to have even from the age of 35 to 40. It is very, very possible, and you can achieve them naturally without IVF. So uh, don't pressure yourself or put yourself at the age because you just want to have children before the age of 35. Although medical personnel will always advise you that it's good that you have all your children before the age of 35. But it's also good that you don't pressure yourself if you're not ready to have children before the age of 35. So I hope this video helps somebody out there. So if you find any value to this video, like this video, share this video, and don't forget to subscribe to my YouTube channel. Thank you and see you next time. Bye.